All right. Looks like everybody should be able to see my screen. If you cannot, please unmute yourself and let me know. Or if you're having any trouble hearing me, also let me know. All right, so this is week 2. This is our overall agenda from all 4 weeks. So we've divided these 4 weeks up into talking about just an introduction of what gut health means, what it looks like to have an unhealthy gut. We did kind of initially start talking about the importance of leaky gut and preventing leaky gut and healing leaky gut. And then we started introducing the 5R restoration protocol. The first step in the protocol was to remove, and now we are going to start on the replace and the repair portion of it as well. Next week, then we're going to be talking more about stress management. That kind of gets a little bit more into the a rebalance piece of it. We do find that you can do all the supplements and all the dietary changes, but if you don't figure out a way to manage your stress and move your body, then you can certainly go right back into unbalanced gut microbiome. So just to recap, these are the things that are going to affect our gut health traditionally in a negative way. Food sensitivities that trigger an over immune response that can lead to general inflammation and disrupt the gut microbiome. Leaky gut, that's the basically holes or tears in the gut lining. These are micro tears. These are not going to be seen by the human eye, but this allows food particles into our bloodstream, and that launches an immune response, and that can trigger autoimmunity. Toxins are all over, in our environment. We talked about pesticides in our food sources and how to avoid those, things like heavy metals and other chemicals, and trying to live a more clean lifestyle. We did talk briefly about bacterial and parasitic infections and how to remove those and how to avoid those. And then today we're going to talk a little bit more about malnutrition and why specific antioxidants and nutrients are essential for gut health. And then we're not going to really touch on the stress portion yet. That'll probably be next week when we go more into the mind-body connection. Again, these are additional factors that contribute to leaky gut. So the leaky gut component is really kind of the gateway of how we get inflammation in our body, right? So there's different components of gut health. Leaky gut is just one of the components. These are the factors that cause leaky gut or contribute to it, like chemicals in our environment, specifically glyphosate in our food supply. That's why it's important to eat organic when possible. Highly processed foods, so fake food, genetically modified foods, antibiotics and other medications, so proton pump inhibitors, birth control has also been shown to cause leaky gut. Definitely that stress and anxiety piece of it. And then how we did briefly talk about how to get rid of these toxins and balance our gut microbiome. That's where we're really going to dive more into that tonight. And we did also establish that leaky gut can contribute to anywhere from just mild food sensitivities and food intolerances all the way up to systemic, so body-wide inflammatory response. And that can trigger autoimmune disorders like lupus, fibromyalgia. We've also seen things like Hashimoto's affected and rheumatoid arthritis, and then ultimately it can lead to malnutrition as well. So we did talk about how to heal the gut, or at least to start healing the leaky gut. You have to remove, right? So you have to remove those triggered foods, the ones that we know are inflammatory for everyone. So gluten, dairy, sugar, peanuts, sometimes soy, sometimes alcohol. Then we talked about also specifically removing our individual food sensitivities. Not everyone needs to do a food sensitive program. Those are usually for people who just want to have the evidence, but also some people who have already done an elimination-based diet and didn't get resolution. Sometimes that's where the food sensitivities are super helpful. And then, of course, we also want to remove those highly inflammatory processed foods that are, genetically modified and fake foods. A lot of corn, a lot of things, breads and pastas, cookies, packaged foods are usually very highly processed. Tonight, we're going to go into the replace and the reinoculate. Replace is talking about putting all the things back in our body. So the remove, we just remove the pathogens, the bacteria, the yeast, the fungus. We remove the foods that are causing the issue. Now we're going to start putting things back in to help us with the digestive process, and then starting to reinoculate, meaning we're going to start restoring the gut microbiome. So that sum total of bacteria that's in our gut, we're going to start restoring that to its healthy balance. We're going to talk about how to do that through food, but also through supplementation. So the first thing that we want to do is replace, right? So we're going to go back in and replace the digestive enzymes. But in order to replace those, we need to make sure that we understand what they do, why they're important, and why we really can't live without them. So there's two aspects of being able to get things in, and we call that assimilation, how to get things in that we eat through our food and get it into our body so we can use it for fuel, right? So we can turn that into an enzyme, we can turn that into a hormone, we can turn that into something that goes into repair our gut lining. So all these things are necessary to be able to assimilate our food into our body. Two phases of that. There is digestion, so being able to actually digest our food. And the second part is to be able to absorb our food. So there's that's where the microbiome comes into play. But there's different types of digestive process in the gut. The mechanical digestion is basically chewing, right? A lot of us eat so quickly that we are, usually eating on the road. We're in between office appointments. We're eating at our desk. We're not really focusing on what we're doing, and we're not being mindful when we're eating. And that mechanical digestion never gets completely done. So we basically we don't chew our food enough, and then we're eating very foods that are not easy to digest either. So a lot of protein, but also fake foods are just not naturally going to be able to digest. Once we get through our teeth and get it to a globulus, we actually are swallowing that, and then that goes into our esophagus. Then our esophagus actually, basically just a long tube that sends it down to our stomach. When it hits our stomach, that's the second part of the digestive process. Going back to the mouth, not only are you chewing your food, but there are salivary amylases, so enzymes that are produced in the saliva that actually start to break down some of the carbohydrates in our mouth. That's why if you put sugar on your tongue, it'll go ahead and dissolve very quickly. So the chemical digestion comes in when the other organs start to do their job. So the stomach produces stomach acid through certain channels in the gut. That stomach acid helps break down a lot of our fat. So heavy fatty foods that's broken down in the gastric juices, which are also called bile acid. Sometimes, that's also called um, excuse me, betaine. So betaine HCl, that's the stomach acid you'll see. And then you have your gallbladder that actually starts to dump some amylases, so other enzymes that break down particularly fat. And then you have your pancreas that also helps produce amylase and lipase and other digestive enzymes like pepsin that actually digest more of your protein. So your body is super, super smart. If you give it enough time and let it know that food is coming, and that actually process starts with like even smelling your food. The olfactory nerve actually tells the brain to get ready. The food is coming. So that's why it's so important that when you sit down and have a meal, be very mindful over that. Like take time, pray over your food, all that's and smell your food. All that's allowing those digestive enzymes to start flowing before the food even hits your stomach. And then after we get out the food digest, then the small intestines and the large intestine, that's when all the magic happens, right? So we're able to take that protein that we ate from that red meat, that big old juicy steak, right? We chewed it up really, really good. We were able to break it down mechanically. We get it to our stomach. All our gastric juices start flowing. Our pancreatic enzymes are being dumped in. Our gallbladder is producing all of its bile that's helping us digest it further. So the small particles at this point should be what's entering your small intestine, right? Most of the digestive process doing more in the stomach. Once it hits the small intestine, that it's usually already broken down into the building blocks of those proteins. Those are called amino acids. And hopefully at that point, they're able to very easily absorb through our intestinal wall. We're going to talk about this in just a second. I actually want to make sure that we talk a little bit more about the mechanical and chemical absorption of these foods first. So what does it look like if we cannot absorb our food readily? So we have symptoms such as bloating. We have a lot of like just feeling full suddenly after a meal, constipation. We just have very slow transit. So constipation, diarrhea, all these are symptoms that your body's not either digesting that food very well, or if it's reacting to it as a food intolerance. Heartburn is interesting. So a lot of that reflux, indigestion, heartburn. So reflux is actually the physical sensation of those liquids. Those digestive foods, digestive juices, foods, and liquids are actually bouncing back up into the esophagus, and sometimes they can come up the back of the mouth. And they can cause a very burning sensation because it's very erosive. All that acid in your esophagus is not supposed to be there. It gets very erosive, and it's very, very painful for some people. Some people have what's called silent heartburn or silent esophagitis. That's the inflammation of the esophagus. They don't know it, but then they start having issues with their voice starts to change. They have hoarseness, those kinds of things. But all that could be symptoms symptoms of low digestive enzymes. So interestingly enough, in conventional medicine, we say, "Hey, doc, I'm having some heartburn, I'm having some indigestion." Well, instead of addressing the root causes, which is most likely either not digesting your food effectively, or more likely that you're eating something that your body's reacting to, that's our body's way of saying, "Hey, don't eat this stuff." Like, it's almost trying to want to come back out, right? It doesn't want to be there anymore. It's letting us know. So what do? We actually just hush it up. Say, "Hush up." It's so much easier just to take a pill. A lot of times that pill is an antacid. Those can be Tums, which are more calcium carbonate. There could be also H2 blockers, excuse me, H1 blockers, which are an antihistamine. Those are like your famotidine and your Pepcid. Those are more of a gentle, modest decrease in stomach acid production by cutting off those histamine pumps. That I've heard as low as like 30% of the stomach acid is reduced with those H1 blockers. Now, the big guns are like your PPIs. So those are your proton pump inhibitors. These are specific pumps in the stomach that actually produce and release the stomach acid. Those are things like Nexium, omeprazole, Prilosec, Dexilant, those kind of things. Those are the big guns, and they can actually shut off 90% of the stomach acid that we are supposed to manufacture. So yes, you have less heartburn because you have less stomach acid. So they, in essence, do help with your symptoms, but they are very much of a band-aid approach. And really, they're only meant to be used for a very short period of time. The FDA has approved them for up to like 4, maybe 6 weeks. Most people are supposed to be only using them about 2 weeks and come off of them. But I can tell you the clients that I've seen have been on it for years, if not decades. So it's really important that we understand like what these things are doing to our body. So when we do the proton pump inhibitors, it inhibits the production of stomach acid. If you inhibit the production of stomach acid, number one, you can get an infection. So H. pylori infections are very common. SIBO infections are very common. So that's that small bowel intestinal overgrowth of bacteria, because the stomach is supposed to be sterile, right? The acid is supposed to be so high that nothing can live there. You're not supposed to have microbes living in your stomach. So what happens is we basically allow them to overpopulate, and then we actually get worsening heartburn. So then we go back and say, "Hey, doc, my heartburn's back." Well, then let's increase your medication, or let's add a second medication, which is actually further worsening the problem. So a lot of times, the goal is to adjust the diet. The goal is to use these medications for a very short period of time and then be able to come off of them. Long term, complications of using those medications can actually be pretty severe. So we see micronutrient deficiency. Your body can't absorb magnesium, vitamin D, some of the other fat soluble vitamins like B12, zinc without enough stomach acid. So we're going to see some micronutrient absorptions. Calcium is another big one, and that's why we see so much bone loss on these medications. Interestingly enough, I had a 44-ish year old brother-in-law who worked in kind of a building trade. He did a lot of in the building, so he was constantly moving his body. Anyway, he was on a job site one day and fell and broke his hip. So when's the last time you heard of a 45-year-old male falling and breaking their hip? They said they did an x-ray and his hip looked like that of an 85-year-old woman because he'd been on this proton pump inhibitor for 20 something years. So it is very detrimental. So we're not supposed to be doing them long. I can go and urge you, I'm not telling you to stop that. This needs to be done under the care provider and help you wean off these medications because there is a rebound effect. But all that to say is like the shortest amount of time on these things and addressing the root cause. And of course, we can have abdominal pain, that's bloating, that's just feeling like an IBS type symptom, can all be symptoms of low digestive enzymes. So the causes of poor digestion, stress is going to be a big one, right? So if we're super stressed out, we're constantly in fight or flight, our vagus nerve is not relaxed, right? So the vagus nerve is the very long nerve that innervates from the brainstem all the way down your body. It controls your heart rate and rhythm. It controls your digestion. So if you're constantly in fight or flight and constantly like trying to protect and, you're not going into rest and repair, you can't really digest your food effectively. And you don't have that peristalsis, that motility in the gut. So everything kind of gets backed up. So stress can impair this. Stress also alters the acid base balances, therefore less stomach acid and sometimes more stomach acid at the wrong period of time. Poor eating habits, obviously not eating the right foods or processed foods or foods that you're causing inflammation in your body. Not having enough fiber. Fiber is a molecule that's generally found in beans, lentils, and then also vegetables. Fiber basically grabs onto water and it helps the transit of the gut. So it helps the gut move more effectively. So all the food and the stool and everything, all the things that after you absorb your nutrients, all the leftover poop, as if you will, that's supposed to move on out. And the medications can also cause this, like we just talked about. So we're going to look here at the digestive process. Remember, the digestion actually starts in the mouth with all of the particles that are in our mouth. So the palate, the tongue, the teeth, all these things are necessary. I have people who have bad teeth or they don't have any teeth at all, and that's all obviously going to impair their digestion. So making sure really good oral health and keeping the teeth that you have. Salivary gland helps you break down certain things like this carbohydrates. Obviously your throat, there's a motility issue there, so you have to make sure that you're going to make sure that you can swallow the globus after you swallow your food. And then of course their liver, the gallbladder, the pancreatic, the stomach, the pancreatic duct in the stomach, and the pancreas, all of it included. And then after all that digestive juices kind of get flow, and then you start putting food into the small intestine. Small intestine is where you're going to absorb a lot of your micronutrients out. And then the large intestine, which is the blue one that kind of goes up and around, that's when you have a colonoscopy. That's what they're looking for, is the help of just the colon. They can't see really well into the small intestine very well. So they're looking for things like polyps and that kind of stuff. And we want to make sure that we're getting fluid absorption from the colon. So that's where a lot of the fluid absorption and reabsorption is going to happen. So these are kind of reiterating, kind of said that earlier, but these are the digestive enzymes that's needed. So the carbohydrates, these are your salivary amylase, your maltase, your lactase. Amylase, they all have kind of like a function, right? So there's different enzymes that digest different things. The lactase is going to digest lactose, which is a fruit sugar. The protein, there's several of these protein amylases, pepsin, trypsin, peptidases, those kind of things. And their fats, like lipase, is the enzyme that kind of digests your fats, and it breaks it down to smaller pieces. That's the goal, is to have only the small pieces by the time it gets to the small intestine and definitely the large intestine. I want to make sure I didn't miss anything back here. I'm going to go back to that in just a second. Okay, so what are the consequences of poor digestion and absorption? Obviously, we just talked about it, but just to reiterate, deficiencies, right? Deficiencies in micronutrients. So we see iron deficiencies, calcium, vitamin D, B12, B6, magnesium. Just about anything has to be absorbed with a healthy digestive system. So long-term consequences can lead to things like anemia and osteoporosis and bone loss. We start losing our teeth if we're malnourished as well. And then, of course, if we don't have the nutrients, then we can't counteract all the inflammation in our body. So we have seen other secondary disease process like inflammatory bowel disease, SIBO, overgrowth, those kind of things that are all necessary, that are all needed to prevent things like leaky gut with micronutrients like zinc and vitamin D. So just another reiteration that these are the digestive enzymes that we typically see: amylase, lipase, protease, and lactase. There's a ton of them. You can take them in supplemental form, or you can also take them get them into your diet. So the first one here, you can kind of ignore the remove. We've already talked about that in the last session. This is the replace. These are certain digestive enzymes that you can take. I actually like to use a combination of them. So betaine HCl, a word of caution with that one, because that one is so strong. That's the actual stomach acid. People who have severe esophagitis and gastritis, like if they had a peptic ulcer, I try to avoid using straight HCl with them because it can kind of irritate that. So you want to basically do a little bit of gut healing restoration before you intervene with the betaine HCl. But you can use things like apple cider vinegar. I know a lot of people have some really good results with that. There's opportunities to use the herbal bitters. Ox bile is a big one for people who don't have a gallbladder. This was probably contributing to one of my root causes why I got so sick. I had my gallbladder taken out at 16 years old. And ox bile is something that can easily be replaced in a supplemental form. And then there's additional enzymes as well. We sell a couple different options in our office. Again, you can get these individual or you can kind of take them all together. And not
Mhm.
everybody needs it, right? If you're not having the symptoms of upper, and these are typically upper GI symptoms like the reflux and indigestion, bloating, then you may not need that stuff. All right. So I do want to kind of hit on why we're doing all these things again, just to make sure that we're addressing not only the digestion in the gut, but the next step is to address the microbiome. But the reason why we address all of these things is but so we can actually help support. Things like long-term benefits, right? So we do know that the gut is the pathway of how we get most inflammatory processes in our body. We've known for 2,000 years. Hippocrates, the father of medicine, actually said that all diseases begin in the gut. So we do know that having a healthy gut is going to improve all of these things. And we have seen a lot of associated lab markers, such as inflammatory cytokines, HSCRP, CRP, ESR, SED rate, all those things associated with the very inflamed gut. Because the gut inflammation doesn't typically stay in the gut. It usually kind of filters down into everything. So it can cause brain inflammation, it can cause skin inflammation, it can cause just about anything. And also, we want to make sure that we're addressing gut health to help support our hormone manufacturing. Um, so, going back to so we just finished our talk on digestion and absorption, and why we're doing that is to prevent micronutrient insufficiencies, but also kind of keeping things moving in our bowel so we don't have a lot of backup effect and have a lot of inflammation. The next piece of the puzzle is to re-inoculate. So we just removed inflammatory foods, we removed food triggers and pathogens. We started to replace our digestive enzymes, and now we're going to go into re-inoculate. So re-inoculate is basically putting back in what's supposed to be there that got missing. So that's the some microbiome. So the microbiome is super, super important. There's a ton of research going into this field of like studying and understanding the microbiome. We've come a long way. We do know that it's linked to just about every chronic disease out there, from cancer, high blood pressure, heart disease, autism, behavioral disorders. Almost everything has been shown in research to go back to the gut. So if we're trying to live longer, better, healthier lives and prevent chronic diseases, that's why we're all talking about the gut health. So what is the gut health essentially? I mean, excuse me, what is the microbiome? The microbiome is basically the sum total of microorganisms. So we are microorganisms. We're an entire human being, but our bodies are made up of just trillions and trillions and trillions of cells. Those cells are both human cells and bacterial and viral cells. Most of them live kind of peacefully, commensally with each other, and they don't really disrupt each other too much. Sometimes they're actually even synergistic, where the bacteria gets our food and we benefit from the bacteria because it helps us make our hormones. And then in some cases, it could be a pathogenic relationship between the human cells and the bacterial cells. That's when we really turn it to run into problems. That's what's called a dysbiosis. So dysbiosis means either not enough of the good guys or too many of the bad guys. We really want as a diverse ecosystem as possible in the body. We talk about probiotics and we talk about this and that, and we're talking about, 2, 3, 4 different gut probiotics or bacteria in the gut. Probiotics is that word kind of basically implies a good bacteria, essentially. It doesn't mean just supplemental, it just means like a good bacteria, if you will. It's a beneficial bacteria. We want as much of that as possible. So we really only know a handful of these bacteria, but there are probably tens of thousands. We have really no idea how much of all of it that we know of. But we do know that the more diversity, the better. Interestingly enough, our diet determines the diversity. Our acid base in our system determines the diversity. Our medications, the things that we put in our body determine the diversity, and our hormones determine the diversity. So a man and a woman usually have a different diverse ecosystem in their system, in their body, and it does go down with age because those hormones actually start to protect the microbiome from dying off. Estrogen, especially, protects the microbiome from dying off. A lot of the weight related to menopause, that kind of menopause fluffy midsection, is actually due to estrogen levels going down and not being able to protect the microbiome effectively. That's why estrogen replacement therapy is beneficial for weight maintenance, mainly because of this phenomenon. But there's probably a lot more complexity to it than just that. We have also seen, I was going to talk about Parkinson's a little bit too and Alzheimer's disease, but anyway, the key here is, diversity. It's good. We want a lot of the good guys and many different types of the good guys. So if you eat the same thing every single day, you're going to have the same bugs that you did 10 years ago. That's why we have to change up our diet and feed it different things. We cannot function. We cannot digest our food. We can't have an immune system. We can't even have a decent mental health without the microbiome. So it does so much of us. We actually have more bacterial colonies, more bacterial cells in our gut than we have in the entire human body. And we have bacteria everywhere. There's a certain kind of bacteria in our skin. There's a certain kind of bacteria in our hair. There's a certain bacteria that's in our vaginal area, urinary tract. Some of those areas are supposed to be sterile, so that like the brain is supposed to be sterile, some of the major organs, but usually if it's got to weigh in, like then through the nostrils or an orifice, then through the body, then usually there is a typical microbiome. Our eyes even have its own microbiome. And the factors that disrupt that, we've kind of already hit on it a little bit, but things like diet and stress and antibiotics can all alter that microbiome. So this is constantly like a back and forth, an army, if you will, or a battle, if you will, between the good guys and the bad guys. These bad guys, if there's a few of them, then our immune system can take care of it. We may never know that we had, a bacterial salmonella in our chicken that we just ate. Most of us can get by with it and never even know we had it. We just basically poop it out, or the good guys kill it off. But if we're already depleted in good bacteria, then yes, we're more susceptible to having a salmonella infection, C. difficile infection, those kind of things. So again, dysbiosis is that imbalance between the good guys and the bad guys. The causes, we kind of just reiterate those, is usually medication, poor diet, toxins in our food supply, genetically modified food, and then chronic illnesses as well, like in hormonal imbalance. There's just a lot of different kind of root causes there. Diet plays a huge role, specifically the pre and the probiotics. We'll talk a little bit more about that. Birth control antibiotics are what kills it off. Anti-inflammatory drugs like NSAIDs can also be linked to this as well. And then the environmental factors, so pesticides, heavy metals. I've seen a lot of people with like heavy metals in their teeth, like the silver fillings are actually mercury amalgams. That can actually, a little bit a day, you can actually swallow some of that stuff, actually gets in through your bloodstream as well. And there has been a small link between heavy metals and gut dysbiosis as well. So that's just a small piece of the puzzle, but it does need to at least be considered. Digestion, and so again, what is the gut supposed to do? It's supposed to help with digestion and nutrient absorption. It regulates the immune system. 70% of your immune system is because of the bacteria in your gut. So if interestingly enough, we take antibiotics to kill off a bacterial infection, and then it leaves us with a dysbiosis, and it takes almost a year for our gut to repopulate, to actually replenish our own natural immune system. So antibiotics are really abused in this country, and we are really going to start seeing even more of a troublesome problem with antibiotic resistance, because we don't have much of an immune system because we're killing it off with a round of antibiotics, and then B, the bacteria is getting used to these antibiotics, so it's not going to work against them anymore. And then, of course, we want to make sure that that bacteria is smart enough to actually be able to identify when there's any pathogenic bacteria like C. diff and salmonella. These are the disease processes, kind of a recap from what we already talked about. That, interestingly enough, leaky gut is caused by a dysbiosis. Dysbiosis is going to lead to leaky gut, and it kind of vice versa as well. And then these are some of the disease processes that we've already kind of reiterated, just that there is an importance that we need to know that we have to have a good, healthy microbiome in order to prevent these neurological conditions like Parkinson's and Alzheimer's, and then autoimmune diseases like Klebsiella, like rheumatoid arthritis. Klebsiella is a bad pathogenic bacterial infection that can actually get into our bloodstream, and that actually launches a potential for a rheumatoid arthritis, because the body sees Klebsiella and it starts attacking a knee joint or an elbow joint. Type 1 diabetes has been associated with this as well. Interestingly enough, most of the type 1 diabetes that I diagnose in children almost always come after a stomach bug or an upper respiratory infection. So we do know that there's a pathogenic association that happens actually in the gut. So these are all the things that we're going to do to help with that dysbiosis. So we're basically going to start repopulating the good guys. Now, in the first chart, we talked a little bit about the removal of certain pathogens that we know are there that need a little bit more assistance, like H. pylori, C. difficile, SIBO infections, sometimes parasitic infections as well. I'm under the firm belief that we do know that there are certain really stubborn bacteria that need an antibiotic, that need to be strategically removed. But most of the time, these bad bugs can actually be killed off by the good guys, the good army. As long as you give the good army what it needs rest, it needs nutrients, it needs water, it needs healthy things to be able to start to rebuild the good, healthy army. So if you're starving your army or just feeding it, donuts all day long, and then it's dehydrated, then of course the bad guys are going to win. So these kind of components to help maintain and help prevent against gut dysbiosis are prebiotics. So those are the things, basically the food, if you will, that feeds the probiotics. The probiotics are the good guys, right? So we eat our fiber, we eat the things that feed the good healthy guys. The good healthy guys become strong armies, and then those strong armies go to work. They fight off the bad guys, but they also create other byproducts as well. So they're not just fighting, they're actually it's almost like the worker ants. It's like the ant colonies, right? Some of the soldiers are fighting the war, some of them are just in the nursing station kind of helping support the injured soldiers, and some of them are carrying materials to each other. So everybody has their own job. All these microorganisms have their own job, and some of these probiotics are supposed to create what was called postbiotics. I hate to use the word pooping, but that's kind of what they're doing. So they're eating our food, they're getting strong, and then they poop out these postbiotics. Well, these postbiotics are very, very powerful. They actually help our body. These postbiotics are actually called short chain fatty acids. We'll talk about those in more detail, but they have work to do. They actually help improve our gut barrier function, and some of them actually create hormones. So let's start with prebiotics. So prebiotics are either in dietary sources, and they can be taken supplementally as well. I'll be honest with you, this is not usually something I tell people to supplement with, just because it's so easy to get these in our diet. You just have to be intentional. And because they're dietary sources, they're also really good vitamins and minerals as well. They're not just the prebiotics. So I don't usually recommend supplementing with these things. It's not a bad idea to do, but they can be pretty expensive supplementation. And I just feel like if you're going to spend money on supplements, let's actually take the probiotics versus just the food for them, because you can really get a good amount in your diet. Prebiotics are typically fiber. So fiber feeds the probiotics. This is one of my main problems with like the ketogenic diet or the carnivore diet. And this is super controversial. This is Diana's perspective. This is Diana's opinion, is that I don't really like long-term use of those. I think that they can be used strategically for short-term use to kind of help achieve like body composition goals or getting blood sugar down or killing off bacteria. But if you're really trying to feed your microbiome, you're not going to do that with usually meat, right? So you need vegetables in this capacity. So things like onions and garlic, bananas, whole grains, legumes. There's tons of these things. Basically, the green leafy vegetables are really good with this. The cruciferous vegetables, broccoli, bok choy, cauliflower, those kind of things. And there's some supplemental forms that are called fructooligosaccharides, galacto-oligosaccharides, and inulin as well. They actually have powerful food, and the gut bacteria just absolutely eats them up. They love them. So that's what we want. A little caveat here, because you probably have seen these words before if you've ever done a FODMAP diet or a low FODMAP diet. So low FODMAP diet is typically for people who are intolerant to fiber. Now let's talk about why that's happening. Why is someone ever intolerant to fiber? A lot of times it's because they have an overgrowth of bad bacteria or bacteria that's in the wrong part of their body, the wrong part of the digestive tract. So remember we talked about SIBO, which is a small intestinal bacteria overgrowth. Because of things like chronic constipation or low transit, some of that bacteria that's supposed to digest your food, it basically creates gas as a byproduct, and you just flatulate it out or burp it out. That's very normal. That's supposed to happen. But sometimes that bacteria creates too much gas when it eats your food, and that actually can be very painful if it's in something like the small intestine. So when people eat fiber, it feeds those bacteria, and the bacteria starts to produce way too much gas, and people get super bloated. They usually complain that they look 5 and 6 months pregnant after they have a meal. That's usually a condition called SIBO, and that needs to be treated. But temporarily, some of the GI docs will put them on a low FODMAP diet and just basically tell them to stop eating fiber, We know that doesn't work for long. We know it helps temporarily, but that's not the long-term solution. And in fact, most of these people get very malnourished when they're on these diets. So just being cautious with that. So I apologize, this slide's a little bit blurry, but this is basically just a picture of prebiotic and probiotic foods. So there's onions and soybeans, asparagus, bananas, leeks, bread, artichokes, and garlics. And then those prebiotics are what feeds the probiotics. Now you can actually eat probiotics. So probiotics are found in certain foods like pickled foods, yogurt, kefir, those kind of things, sour cream. Most people will intentionally eat these probiotics because they love them or they're trying to really do a lot for their gut. Most people are just going to take a probiotic because they almost have to eat them every single day. Most of these probiotics are not going to colonize the gut and start living there. They do their job and then you poop them out the very next day. So that's why I like taking a daily probiotic. I think it's beneficial. We actually sell a supplement in our office called Opti GI Cleanse. This is as close that we offer to a prebiotic, but it's also a really good source of protein, and it's got some fiber and inulin in it. It does a really good job feeding the microbiome. I have given you a sample of this in your little kit. You do get a I don't know if you can see me if you're just sharing my screen, but I'm gonna show you anyway. I'll show you at the end too. There's a little kit that we've got little samples of the OptiCleanse. This is amazing. 13 grams of plant-based protein, but it's got all the wonderful prebiotics in it that your body needs. And proteases in it. It's got your digestive enzymes as well. So this is an easy to use pack once a day. And then we've got some other goodies in here as well. I'll go over there in just a second. But again, you don't even have to take the supplements. You can get that one from your food. So these are the probiotics. Again, I usually will recommend a supplementation. If you're going to spend money on supplements, choose the probiotics over the prebiotics. That's my philosophy. But you can also get it from food, like we just talked about: yogurt, kefir, sauerkraut, kimchi. A lot of these things, if they make you feel worse, it's because either you have a histamine intolerance or you've got the SIBO infection. So if you've ever been someone who tried a probiotic and got worse, then you got a really bad gut dysbiosis. So I usually recommend starting slower. So maybe try a different brand or just a smaller amount and then work your way up to it. We have carried several different probiotics in our office, and there's several you can get online. I would just warn you that there's a lot of gimmicky stuff out there when it comes to probiotics, and people saying that, hey, you have to be refrigerated to get a good quality brand. That's actually not true. Kind of think about it, the gut's not really refrigerated, so if it's that fragile that it dies off at room temperature, then it's definitely going to die before it hits the small intestines and the large intestine. So I usually like a shelf-stable probiotic for that case. And I think this has got a little bit of mixed up here. So we're going to go ahead and talk about how to choose your probiotic. Typically, most people are going to need anywhere between 30 and 50. If they have been on a course of antibiotics, actually, so we'll double that. Take 100 billion CFUs for roughly about a month after, then you can go back down. Make sure you've got a good quality label. Most of them are going to be third-party verified. They're going to have labels on there like non-GMO and vegan, gluten-free if you're having some issues with gluten as well. And then understanding the strains, we're going to talk about this just a little bit, and then making sure you got the delivery form that you want. Some people just prefer chewables. Some people prefer the capsules, the powders. That really doesn't matter as long as it is shelf stable. You should be okay with that. These are some of probably the most well-known probiotics out there. So these are the ones like Lactobacillus rhamnosus, help support the immune system and the barrier function. Remember, all these probiotics are genus species. So there's tons of different lactobacillus, tons of different bifidobacter, and we've been able to isolate them down to the species level, which is pretty amazing. And that specific species has a specific role to play for digestion. Saccharomyces is actually not technically a probiotics. It's actually a beneficial yeast. Saccharomyces has been studied in the literature a lot, especially against inflammatory bowel conditions and things like Crohn's and colitis. It's got some really good evidence to support that. That's actually a really cheap probiotic as well. This one's a really good one also if you want to take, the brand name is called Florastor, or sometimes you can just get it as Sac Bellari. Really good one to take after a round of antibiotics. All right, and this is another one. So there are specific, and sometimes you'll see it on the label, like this probiotic is for digestion. This one is for leaky gut. This one is for antimicrobial resistance, those kind of things. But the Bacillus coagulans is one that helps support their bloating and the immune function. And now they're getting really trendy. There's some ones that are specifically out there for mental health and the gut-brain axis. I've been sampling some of those with my patients here recently, and they've getting some pretty good results, but it just takes time. 4 to 6 weeks, typically, anytime you're on a probiotic to see actual results, 4 to 6 weeks. So these are the commensal bacteria. Most of them are commensal. So these are the ones that just live in our system. They're not specifically beneficial. Most of them are not going to be truly pathogenic. Just this is basically just letting you know that there's just tons and tons and tons of them out there, and they have their own specific role to play. And so we talked about the prebiotics that are feeding the probiotics. The probiotics are pooping out short chain fatty acids, which we call postbiotics. So short chain fatty acids are basically coming from the fermentation of dietary fiber within the gut. The ones that we typically know the most of is the butyrate, acetate, and propionate. Butyrate is probably the best studied one. We've seen a decreased risk of colon cancer for people with butyrate. So possibly, theoretically, short chain fatty acid deficiency could potentially be a root cause of certain gut related cancers like colon cancer. So kind of an argument that we should either be taking short chain fatty acids, or we can just make sure we have the right probiotics and prebiotics to have them make it themselves. They actually feed the colonocytes. So all the cells in our colon that line our colon, those little soldiers that stand shoulder to shoulder to help protect our gut lining, to be able to identify which particles are going to get into the bloodstream and which one has to stay in the gut, which one's bacteria, which one's pathogenic, those kind of things. They all need to be fed too. All those soldiers need to be fed. And what feeds them are these short chain fatty acids. So they're basically feeding the cells in the colon. So obviously, if there's not enough of them, then we do start to see things more like leaky gut. Okay. And then this is an interesting one. This actually was supposed to go in the leaky gut one. We were going to talk about mucin. I forgot to put it in there. So I wanted to make sure we talked about it. So mucin, and when we talk about leaky gut, the soldiers need to be fed. They need to be strong. That's the actual colonocytes that prevent against leaky gut. But we didn't talk about that there's a very thin layer of mucus. So mucus is actually there to kind of like it's in our nose, right? It's in all of our mucous membranes have some aspect of mucus to help us not get bacteria through that. Mucin is actually manufactured by a specific strain of probiotics called Akkermansia. Akkermansia is all in the literature right now. Everybody's talking about Akkermansia because Akkermansia is actually the specific keystone strain that's making GLP-1. So GLP-1 is that wonderful hormone that kind of gives us satiety, that tells us we're full and we can't overeat. It also kind of protects us against we've seen indications for diabetes. It reduces your risk for kidney issues. It reduces their possibly heart disease risk. So there's this very, very powerful, but the way it works is primarily the GLP-1 hormone is made by Akkermansia. So if you're deficient in Akkermansia, then you're going to likely to be deficient in GLP-1 production as well. But GLP-1 also produces that mucin layer. So it does a lot. So this is it's a powerhouse of a probiotic. It really is. So it protects against leaky gut. It strengthens the gut lining. It improves the gut integrity, protects against the bacterial infections. And then obviously it produces GLP-1 as well. This is just a slide to tell you a little bit more about what GLP-1 is. This is probably a little complex. I probably shouldn't have put it in here, but I just love this stuff. So this is Akkermansia. This is the actual probiotic, and it's creating all these molecules, if you will, that go in and feed the colonocytes. They improve the mucus layer, which is what you're seeing in yellow. And then it poops out all this wonderful production of GLP-1. It also reduces interleukin-6, which is a pro-inflammatory cytokine, along with other interleukins. So this probiotic actually reduces inflammation. It improves satiety. It improves insulin resistance and glucose intolerance, and it actually helps you with thermogenesis, which means helps you with energy production and fat cell shrinkage. So you lose fat, not just by eating this, but actually it does induce thermogenesis as well. So it helps you burn fat faster. I'm actually a pretty big fan of these medications if they're used correctly. I think that we hit all the highlights there. So that was my little spiel on Akkermansia. And Akkermansia can be used as a standalone probiotic. You can take it individually. I always like to tell people, please don't waste your money on probiotics if you're not going to eat good food, because it's just sprinkling water on a forest fire. So you have to make sure you put the fire out. All right, so that was kind of a recap on the re-inoculate. So we talked about the remove the first week, then we talked about tonight the replace and re-inoculate. We're replacing our digestive enzymes through our diet. So we're also going to possibly take some supplementation if we're having a lot of digestive issues. What we want to try to avoid is the things that stop our digestive enzymes from being produced, like proton pump inhibitors, high stress, lack of exercise, and then toxic foods. And then we're going to work on re-inoculating, so replenishing that microbiome through probiotics and probiotic-rich foods, making sure we're feeding such foods through fiber intake and a variety of fiber if you can, different kinds of fiber. Trying to get most of that in through your diet. And then hopefully the end goal is to produce more short chain fatty acids that protect our gut from leaky gut, and then also bacterial dysbiosis that's going to cause a whole slew of inflammatory responses in the body. So I hope that that was a good kind of a recap on everything we've done so far. We are going to kind of dive a little bit more deeply next week into the gut-brain axis, specifically how to prevent behavioral and mood issues, and also help with the hormonal production as well. We're going to introduce kind of a long-term plan for your food. I really like for people to stay on that elimination-based diet if you're choosing to do that now, or you can do it later for 21 days minimum, because it takes 21 days for these antigens to get out of your system, and then hopefully 28 days if you can challenge yourself to do that. All right, I am going to open it up for any questions that we may have. Again, you can certainly unmute yourself. You can put it in the chat box, or if you think about it later, you can put it into the group chat from the app. One question here, how long do you remove before beginning to replace? That's a really good question. No one really agrees. There are some people that do it all at the same time. Some people wait a couple weeks. I usually kind of do it all at the same time. But there's no harm in waiting. You're probably going to get better benefits for the probiotics that you're doing, the digestive enzymes that you're taking, if you kind of wait a couple weeks. So definitely within the 4-week mark, you're going to get better results if you introduce these things, but there's no specific timeline. Nobody really agrees on when you do everything. I kind of hit everything fast and do it all at the same time, but you can certainly wait a couple weeks. That way you get more benefit, especially if you're using supplementation. But again, supplements are not necessary. You can do this through diet and lifestyle. I tend to think it's a little bit more sustainable that way, kind of forming some really good habits. But supplements are pretty easy as well. All right. Continue to ask any questions. I'm going to show you your little gift bag. Again, we've got your OptiCleanse, the prebiotic mix that's also fiber and micronutrient support. I gave you a chocolate and vanilla of those. That's actually a medical food. That's not just a protein meal replacement. It's really good for you. And then zinc, we've kind of briefly talked about the zinc benefits for leaky gut, and we have seen zinc deficiency with lack of digestive enzymes. Zinc also helps everything. It helps support thyroid function, mental function, energy metabolism, but it's really, really good as an antioxidant. So it works in the immune system. These are pretty easy to take. There's about 15 milligrams in here, so you're not going to overdose on 15 milligrams. I do tell people to take it once a day with a meal. So you get a bottle of that included. And then I gave you about 10-day supply of a probiotic that you saw on the screen. So this is just a broad spectrum. This has got about 10 or 12 different strains of probiotics, and there's 30 billion CFUs. Comes in a little blister pack. They are shelf stable. These are really good. And remember, if you're going to take a probiotic, better to take a non-spore probiotic with food. So some people just take it at bedtime. That's probably okay. A lot of that work is done in the evening time. But there's an argument that says that it needs to be taken with fiber at the same time. So usually dinner is a good time for that. You guys can come pick these up at any time. They are up there. Anybody with the gut health, even if you didn't attend tonight, you can come pick this little, and it's a cute little cosmetic bag with our name on it too. So those are yours. Come pick them up whenever you want to. And then next week we'll meet next Thursday again. This is going to be recorded. If anybody has wants to kind of follow up and recheck it again or send it to your friends, you're welcome to do so. All right. Thank you so much for attending. I will be periodically watching the apps. If you want to send additional questions, you're welcome to. Thanks so much. Have a good evening.